News First, NEWSLINE Prime with Araz Shaukatali.
Well, hello there. This is NEWSLINE. Unfortunately, sometimes we do things that are not live. This is a recording, but it's a recording because our guest is a very busy person indeed and plays a dynamic role in something much more important than politics. He helps people get on with their lives. And to see what we're talking about, well, let's start talking to him. He's right here in the studio with us, Dr. Kavinda Rajapakse. Very good. Hello there, Dr. Kavinda.
Hello, Faraz. How are you?
And tell me, Dr. Kavinda Rajapakse is a plastic surgeon. Why the term plastic surgeon?
Yeah, a lot of people ask me that actually. It's nothing to do with plastics, I would say. In Greek, plastikos means formation of form and function, and the art of surgery which does that is termed as plastic surgery.
Right.
Actually speaking, plastic surgery was there before the invention of plastic in the world.
Right.
So therefore, it's because of we are involved in the specialty of surgery, which involves formation of your form and function.
Right. Okay.
So that's how the name came about.
I see. And what's the route that one takes to become a plastic surgeon?
In Sri Lanka, actually, we have to first become a MBBS doctor,
right,
and then further qualify to be a general surgeon.
Right.
That is about 3 years and 1 month of training.
Further
after the MBBS,
right,
then you become a surgeon, and then you opt to subspecialize.
Right.
And that is another 4 years of training.
Right.
2 years of local training as a plastic surgical trainee, and then you have to go to a developed country to further train for another couple of years. And then when you come back only, you will be qualified as a consultant plastic and a reconstructive surgeon.
So
that's altogether about
10 years.
Altogether about 7 years surgical training,
yeah,
plus the MBBS.
Right.
Yes.
Okay. I see. So anyone with less than that won't be qualified. My place is still quite risky.
Not in Sri Lanka as well as in other countries. It's sometimes it's further longer.
Does this keep you busy every day?
Yes, kind of.
So there's a lot of what your work is not. It's actually the opposite of cosmetic, isn't it? Yours is.
I am mostly involved in reconstructive surgery.
Right.
Yeah, but we do cosmetic surgery as well. But that is only part of plastic surgery.
Right.
And that is the one which is mostly known to people.
Right.
But other than cosmetic surgery, we do a lot of reconstructive surgery. For example, like from the birth itself till somebody passes away, we do all sorts of reconstructions, like from birth defects to trauma, accidents, and cancer reconstruction, as well as burn reconstruction, and then when there are acquired deformities where you have industrial injuries and hand injuries as such, so we correct all that to a place where that person can function back in society, as well as to give them a better appearance at the same time, not just function, form as well.
When somebody undergoes the trauma of having to have, let's say, their hands reattached, some part of their arm or whatever, what do you think is the greater trauma? Is it the mind over the actual thing?
That's a very good question for us, actually, because it's a very traumatic event. So they have a huge amount of mental trauma, which you have to rehabilitate, of course, and then you have the feeling of loss of a limb. So once you reattach, then when they see that functioning again, most of that trauma gets eliminated. So therefore, it's a short-lived one, and if it is compared to not having a hand versus having a hand. So it's always better to have the hand plus a functioning hand, so that they can get back to where they were in their lives before. So I think most of them, they recover very well.
And I know you've come back from Australia, and you've been here. You've been here since what, 2014?
I came back in 2014 January.
So I'm surprised that you are kept busy because, you know, we didn't have a war from 2014. The war was all gone. So when I'm thinking reconstructive surgery, my mind's going to the war.
Yes. Actually, if you consider road traffic accidents alone, the number of victims we get per day is more than what we got during the war per day.
That's a lot.
That's a lot. Yeah. So war was actually just a small proportion of what we did. It's huge, the other amounts. But they were masked during the war.
These are all from road traffic accidents?
Mostly, yeah, mostly. And then, of course, these cancer patients who needs reconstruction after the cancer has been taken off.
Right.
Then babies born with defects.
Right.
And burn victims. So all those patients are rehabilitated and reconstructed now.
Right.
Yeah.
And is plastic surgery reconstructive surgery? It's available freely on the under the state system.
Yes, actually we have all our teaching hospitals in the island.
Yeah.
They have a plastic surgeon currently covering the whole areas of the country, and then of course military hospital we have plastic surgeons. But the main thing is now most of our state hospital doctors, almost all, are fully committed to their state commitments, and we do not do cosmetic procedures, pure cosmetic procedures in the state sector, but everything else we do in the state sector. Everything is available.
Let's see. Do you need much, you know, after you've done the reconstruction, do you need a lot of care?
Of course, yes. For example, if I reattach a hand, my work is only 50%. Rest of the work is from the patient as well as from the therapist, because that hand needs to work.
Right.
So if I reattach a hand, if that patient just lies alone with that hand without doing any exercises and rehab, that will be as bad as a not
so you've got to get it going. And then there are procedures which we do later on to fine-tune. And then the nerves has to grow, so the sensation has to come back. That has to be monitored, and the tendons has to function smoothly, and the joints have to be mobile till the tendon starts functioning and the nerves take over. Right.
So a lot of work after the procedure. Yes.
Right.
Yeah.
I see. I wonder whether we should be. We're going to play some clips, I think, and we can talk through them. Is that what we're going to do today? Control room. There you go.
Yeah, that's actually a reattached hand.
Right.
If you noticed, Pras, it's all functioning, all the fingers are moving.
Yeah.
And he has got sensation back as well.
Okay.
And mind you, this is after 9 months of reattaching.
After 9 months?
9 months, yeah.
Okay.
So he had to undergo a lot of rehabilitation and exercises to get there. But he's a young chap. Now he's riding his motorcycle with that hand.
Oh. And how did that happen, can I ask?
Yeah. If I remember correctly, it was a defense injury from a personal fight.
Okay.
So I think it's a sword cut.
Oh.
He was defending himself when the sword was aimed at him.
In this case, do you remember, was it completely severed?
No, I think there was a small attachment from the thumb side.
Right.
But everything else was completely cut. It's probably about 95% cut.
Right.
Yeah.
Wow. Okay. So he's a happy chappy now, isn't he?
He's quite back to his normal life.
Mm-hmm. And probably riding his motorbike again. So that means it's all working.
Yes.
And then, what do you say? Let's have a look. Here goes. There's another one here.
Yeah, that's actually an interesting patient.
Yeah.
He had lost his thumb. I think we may have a clip on the still clip where he has this pre-op photo.
Yeah.
Where he has lost his thumb again with some industrial injury.
Right.
And he only had the 4 fingers.
I see.
And when you consider that kind of an injury, you can't do much with only one planar fingers, because thumb is in a different plane,
right,
which gives you about 80% of hand function together. So what I did was I got his index finger and created a new thumb.
Oh, I see.
Yeah, so he's got the thumb and 3 fingers now.
So you need the thumb, don't you, really?
Very much.
Yeah.
So now he's got a functioning hand with 3 fingers and a thumb, which is almost as good as what he had.
Right. Wonderful. I mean, he must be he must have a photograph of you and must be watching it every morning.
Possibly, I don't know.
I hope so, because, you know, doctors, nurses are not really, in my view, they're not appreciated enough. People must remember that I've been treated in National Hospital for a gunshot wound, and the level of service that they took was absolutely brilliant. You know, I didn't need a Western doctor to tell me that. It was superb.
Yes.
And the emergency care was absolutely wonderful. And even the nurses, you know, thereafter, post the operation.
That's true.
It's obvious that they're doing a job that they want to do. It's not a job. And, you know, therefore, the level of care, they do it with a lot of passion and feeling. And kindness. You need to be kind, I think.
Yes, that's very true, yeah.
To me, I don't know if the government does enough to pay them and to take care of them, because they're worth every little bit. I just thought I'd say that because I wanted to say it. What would you say is, how many incidents do you think is happening every day?
Oh, a lot. I don't have the statistics at the moment, but huge amounts. Mainly, most of them are the pathetic stories. They are preventable, especially these road traffic accidents, industrial injuries. All those are because of lack of discipline, and our guys are not properly trained. Like for example, when I was working in Australia, if you are to do a carpentry job or a plumbing job, you have to have 3 years of training, being an apprentice, like an intern. Then only they will give you license, and they check your safety measures, whether if there's no safety in whatever the instrument they are using, they will not even cover it with insurance. But in Sri Lanka, we don't have such a strict regulation, so therefore a lot of these industries happen because of the negligence and the non-proper trained occupants of these instruments.
And do you think that the health, I don't even know whether we have a health and safety executive. We must have something like that here. Do you think they're not being...
I'm also not sure about that, but most of the time, I'll give you an example. Now, when you have these big wheels which cuts tree trunks, they come with a guard.
Right.
And most of the time, we don't see the guard because they have removed it for their ease. And that can easily go and sever your hand.
Right.
And another example is these three-wheelers.
Right.
They have a lock where they can't turn more than 45 degrees, so that they don't topple. But most of these are broken, so that they can turn quickly at the same time. So all these safety measures are there for a reason. But our...
what is it about us that makes us so flippant when it comes to these things?
I think probably it's the lack of regulations and the strictness. If they are quite strict on those, I think people will adhere. Because other countries also, there are people who will try to do that, but their laws are so strict, they will not even dare.
They won't dare. Yes, because they respect the rule of law.
Yes.
And they're frightened to break it.
And there are consequences. They might not be covered by their insurance, and they might not be taken to the state hospitals. Like if it is accidental, not pure accidental, they will have consequences.
There you go. On that note, we're going in for a short break. Don't go away. After all, this is Newsline.
News First, Newsline Prime with Araz Shaukat Ali.
And welcome back to Newsline. We're in conversation with Dr. Kavinda Rajapakse. He is a plastic surgeon. Also, better, probably that's the best way you're known, but otherwise you're known as a reconstructive surgeon, is it?
It both goes together, actually, plastic and reconstructive
surgery.
surgery.
I see, okay. Now then, what would you say is we've spoken that the reconstructive part of it is keeping you busy every day. What about the cosmetic angle of what plastic surgeons can do?
Yeah, it's like this. Most of the patients we get, or I wouldn't say patients sometimes, the person who comes to us, they have some problem with their appearance or something of them which is not giving them enough confidence for their day-to-day life. So that's again kind of like a stressful event for that person. It's not purely just getting yourself looking nice. For example, if somebody has a little bit of a crooked nose, he may not be going into the society straight with a straight head because he's quite conscious about his appearance. So that kind of individual will easily can get that corrected by coming to a plastic surgeon, and then that will build a lot of confidence in him, and that person will have a better quality of life, I suppose. So it's not always just a pure need, but there is a element of illness as well.
Right. I was just thinking about this. So how big is the, do we have loads of plastic surgeons in Sri Lanka?
Yeah, we've got loads actually. We've got 15 of them.
15? That's all?
That's all.
Oh my goodness.
At the moment we have 15 qualified consultant plastic surgeons.
No wonder you're busy.
Yes, and we've got about 7-8 trainees under training, and then there are acting plastic surgeons also. But at the moment we are in quite a few numbers. I mean, for example, if I consider where I worked in Australia, that department itself had 12 plastic surgeons.
Right.
So for the whole country we have 15, and the Australian population is the same as ours.
Indeed.
And this was only a state hospital, South Australia.
Gosh.
Yeah. Amongst many other hospitals which had more plastic surgeons. So
maybe these statistics ought to be used by the Department of Motor Traffic and put big billboards up and say so that people will drive a little bit more carefully.
If they want it properly reconstructed back, yes.
Yes, yeah.
That's a good
point. But do you get instances where cosmetic surgery is done, pure cosmetic surgery is done in the state?
No. State does not fund for pure cosmetic surgery.
So for that you need to go to the
private sector.
Yeah. Do we have enough of a big private sector here, or?
We do have. Actually speaking, all these qualified plastic surgeons are the ones who does in the private sector as well, after hours of their government service.
Right.
So it's limited.
So the market's still limited.
Yes.
Probably explains why there's a net outbound people who go out of the country for cosmetic.
Yes, true. But actually speaking, now it's the other way around. A lot of people come to Sri Lanka to get it done because they find it much cheaper, and they can probably enjoy Sri Lanka as well.
Yeah.
So yes, it's turning the other way around, and our plastic surgeons are also quite skillful. So they have been quite proving themselves better than sometimes in other countries like our neighbor countries. So we have given a good quality service so far.
And do you think that this is another industry in the making? It's sort of medical tourism.
That's a very interesting question. It's already an industry in some way for us, because now we have a few 15 or few qualified guys.
Yeah.
And because of that, some have got an advantage.
Right.
And then there are places where there are no qualified plastic surgeon, but cosmetic surgery is being performed in the country. So that kind of opening up of avenues have become a fashion lately because of the lack of plastic surgeons. Maybe that may be one reason, I don't know.
Right. So do you think that it's, do we have enough regulation?
That's a difficult question to answer. But yes, no, it's like this. If you are to practice surgery in our country, the regulation is if you have an MBBS as a basic doctor, you can.
Right.
So you are safe.
Right.
But I am advising the patients or the person who seeks the help of a plastic surgeon to go through the websites where we have all these qualified guys are enlisted in the, for example, SLMC website has, then the Postgraduate Institute of Medicine website has the list
so
of.
You can check if
they are qualified.
Right. So if they've done their 3.5 years and 4 years and so on.
Because the list is there. These are the board certified qualified plastic surgeons.
Right.
So anybody who is not in that list is not a qualified plastic surgeon in Sri Lanka.
And Dr. Kavinda Rajapakse, do you need any special skills apart from being able to become a doctor, which is a special skill in its own self? But then thereafter,
I doubt it. I'm a plastic surgeon.
Okay.
No, it's like this.
Was there anything in your youth that you did that you knew, well, this guy's going to become a surgeon? Were you a good artist? Were you what?
I do paintings.
Right.
Yeah. Yes, it will help if you are a artistic fellow.
Right.
Because plastic surgery is all about reconstruction, sculpturing.
Right.
You're basically sculpturing your body, putting back things together, making it work. And you have to have the 3D concepts.
Right.
And for example, when I'm harvesting a flap, I should have the picture in my head that is going to be enough to cover the defect the other surgeon or the cancer surgeon has caused.
Right.
So these all will help if you have an artistic background.
So you're a bit arty and maybe
you'll be better than others then.
Right. And I want to ask you this. I think we're coming to the end of our time. If Dr. Christian Barnard was the godfather of open heart surgery, he's credited with being the first to have done heart surgery from South Africa, of course. Then, if he was the godfather of the cardio world, then who would you say is the godfather or the mentor plastic surgeon in this?
Yeah, actually, when you consider modern plastic surgery, so Harold Gillis is the father of plastic surgery.
Right.
And then if you consider the whole of medicine, Sushruta, who was an Indian surgeon in 600 BC, first performed plastic surgery.
600 BC?
BC, yeah. There's documented evidence and papers published by Sushruta doing a nasal reconstruction, rhinoplasty, making a nose.
Wow.
For a person who has chopped off his nose as a punishment. So he has created a nose with using the arm and a flap. So that was the first documented plastic surgery done in the history of medicine.
Goodness me.
Yeah, so he is considered as the father of plastic surgery in all time. And then probably Harold Gillis is the modern plastic surgery.
So he's the contemporary equivalent.
Yes.
Right. Well, Dr. Kavinda Rajapakse, thank you ever so much for agreeing to come on NEWSLINE.
Thank you so much.
And to join the many who've passed through the studio, award-winning authors, politicians, of course, by the score, and members of the public and the people who are very civic-minded, and of course, Dr. Kavinda Rajapakse. Thank you ever so much, because you're obviously doing a much-needed and wonderful job. May God bless you and give you further courage to go ahead and do even more.
Right.
Thank you
so
very
much.
Thank you.
Thank you so much.
And that's the way it was on NEWSLINE. We trust you enjoyed the difference, and we certainly did. Take care, and God bless you.
News First, NEWSLINE Prime with Faraz Shaukat Ali.